All right, so what I would like to do is just introduce Lauren Friedman, who this is. She is a repeat, if I can use that word, guest for our presentations. She had already presented earlier about prescription abuse and how to make sure that you maintain proper prescriptions and balancing out and safety with that. And today she's going to talk about a program that actually, to me, is something very dear. It's a training. I took a training through another organization on suicide. They called it suicide first aid. So what you're going to learn today, as far as I understand, and Lauren can correct me if I'm wrong, is that first of all, to notice the signs. What are the signs of suicide? What are the things that you should be aware of? If you think that someone is going through that, or even if it's yourself, where you can find help. But if it's someone else, what you can do to sort of triage them, if I can use that word, and then provide them with the proper mental health professionals that can take it from that first aid to proper care. Again, it's very important, not necessarily for ourselves. If you feel like this is not you, then the reason why you're here today is because you have a friend who you might not realize is going through a really tough time, or someone who might not be your friend, but you're engaging with them and you hear a comment or they make a statement about something and you're like, wait a second, this doesn't sound right. So today, think of it as a powerful tool in your own toolbox of recognizing and as well addressing the suicide prevention and the suicide that truly is amongst our community or amidst our community. And as I put into the email, this was really taken off of the Area Agency on Aging's webpage about this program, that 25% of suicides that happen in Maricopa County alone are older adults, which is to me, that was a shock number. So I think this is truly an important presentation. Again, whether it's for ourselves, for a family member, for a loved one, or a stranger, you hear something, we'll learn a lot today about properly recognizing it and helping when this does come up. So this is, again, Lauren Friedman. She is coming to us today on behalf of the Area Agency on Aging, but I know that earlier someone asked, and I'll read the chat since Lauren put it over here. Someone asked, what's her background on this? So her background, again, is going to be shared by her, but for us, this is things that she has trained to teach. So for example, I took Assist as Assist is an organization that provides training for suicide first aid, as I've always been taught it's called. Because again, you can only provide the Band-Aid before someone can provide the proper care. But it's one thing to take the course, it's another thing to be an instructor and someone who can give that course and talk. So just within that itself is a lot of education. But without any further introduction, I'm going to let Lauren talk more about herself and about this important topic.
Okay. Thank you so much, Rabbi. So as Rabbi said, my name is Lauren Friedman. I am a prevention specialist with the Area Agency on Aging Region 1. I am not a counselor, I'm not a therapist or a psychologist, but I am trained to do mental health first aid, safe talk, which are both trainings around suicide. Like Rabbi said, you know, what to do if someone is showing signs and symptoms and how to connect them to persons that can help. So in this training today, it's called A Matter of Life, and we will be talking about suicide. I know that can be a challenging topic. It can be very sensitive. And I'll be honest with you, this is the first time I've ever done this on a virtual platform. I have many years experience doing this in person, but it's going to be a different experience for me doing it today virtually. And so I can see some of you right now in your screens, and I know some of you are calling in. I did include my contact information in the box. I put my email in the chat box. I put my email and my phone number. I'm happy to talk to anybody that might need some support, resources, things like that. Just know that I'm here as a support. I want this to be a safe space. I want this to be an opportunity where you can share if you'd like to at your comfort level, but just as a reminder, this is a recorded presentation and it will be posted online. So just keeping that in mind as we go through the presentation today. if you are looking for follow-up information, training, resources, mental health first aid is an amazing training. It's an 8-hour training. Safe Talk is about a 3.5, 4-hour training. And then Assist, which is what Rabbi was talking about, is a 2-day training, but it is an absolutely phenomenal training to learn more about how to not only recognize suicide, but also to be able to help somebody and to be that intervention resource for them. So are there any questions or anything before I get started in the PowerPoint that anyone would like to ask or address at this time? And Rabbi, you might need to help me too if I can't see everybody.
Does Phoenix have a suicide prevention phone number?
So we do. We have our Maricopa County crisis line, which will be shared with you today in the presentation. There is a national suicide prevention lifeline as well, and that actually goes based on your zip code. So if you have an Arizona zip code, then it's likely that one of the crisis centers here in our state would pick up that call, or it can be transferred to somewhere locally. So yes, we do have resources here in Maricopa County and in Arizona that I will share with you as well.
Okay.
And Lauren, just
Yes.
for you, I know that once you start PowerPoint share, you probably lose all the cameras then, right? You'll just see.
Yeah, I do. I can only see a few of you right now on camera. So
you can
again, if you
right
have
now.
a question, just unmute yourself and go ahead and
So
talk.
Lauren, for
Or
yourself, you can, I spotlighted you. That's why you see only a couple on the top. You can change your view to gallery view on the top right.
oh,
That will show you all the cameras.
there we go. Okay, thank you. All right, so I'm going to go ahead and share my screen. Is everybody seeing this?
Yes, we see you.
Okay, thank you. Just want to make sure. Okay. Okay, so again, this presentation is called A Matter of Life, and we are going to be talking about suicide. I will also be talking about depression and anxiety as well, but the main focus is talking about what are some of those signs and symptoms, how can you recognize them, what can you do to help somebody that might be experiencing those symptoms, what to do to connect them to resources, and how to be somebody that can help somebody in that time of need. And so we'll be talking about that as we go through today. So my first slide here, and it's going to be a little difficult because, well, let me see if I can go to gallery here. Those of you on video screen, I want you to read this slide. So it said, suicide can be prevented even if a person feels determined to take his or her own life. So just by a show of hands in your camera, how many of you agree with that statement? So just by a show of hands, how many of you agree that suicide can be prevented even if a person feels determined to take his or her own life? Okay. And unfortunately, even in gallery view, there we go. I can kind of scroll through. Just keep your hands up if you did raise your hand so I can kind of see. Okay. So some of you are raising your hand. So as we go through the presentation today, we will talk about this and we will talk about what this looks like. But being able to talk about this is really important. So I just wanted to get a feel for where we were at as a group. My next idea for life is we need to watch out for one another. So who do you think is most at risk for suicide? Does anyone want to share who they think is most at risk for suicide? So go ahead and unmute yourself and go ahead and share if you would like.
Would it be somebody who's isolated,
Okay, very good. So somebody who's isolated,
doesn't have a good support system?
doesn't have a good support system, absolutely. Any other ideas?
Somebody on drugs?
Okay, so maybe someone under the
Seniors.
influence? Teenagers.
People who have a poor
No,
self-image.
seniors.
Oh, I'm sorry, seniors. Seniors. Okay, good. Thank you for sharing that. And then I heard somebody else.
People who have a poor self-image.
Okay, poor self-image. Is that what I heard?
Yes.
Okay, poor self-image.
Depression.
Okay, someone who might be experiencing or have depression. Very good. You guys are a very informed group of people. I love that. Yes, seniors are actually the most at-risk population when we're talking about a population of people that are most at risk. So sometimes when I do this presentation, I might hear teenagers, I might hear adults, I might hear veterans. While those can all be people that could be at risk, when we talk statistically, older adults, 45 to 54, and then 85 plus, believe it or not, 85 plus Caucasian males have the highest completion rate of suicide of any age group and demographic. The reason for that is because the method in which they choose. And so we find that people who use firearms are more likely to complete suicide. And for those reasons, that's statistically the highest population or age group that is at risk. However, when I say that, I don't want to just pigeonhole anybody in saying that those are the only people at risk, because a lot of you that did share, you mentioned really good things. Isolation is a big risk factor, which we'll talk about. If someone has depression, that can put them at risk. If somebody is under the influence of drugs or alcohol, that can put them at risk. So there are things that can put people at risk that they are experiencing. But seniors, like I said, are the highest when we talk statistically at risk for suicide. And also females tend to, did somebody ask a question?
Yes, I was asking, what about bullied teenagers?
Yes, and bullied teenagers absolutely can be higher at risk too, absolutely. So when we're taking a look at this information, I want you to think about not just a group of people, but think about people on an individual level, because individually, people are going to experience things, they're going to take things differently, emotions can come into play, whether or not somebody has a diagnosis of a mental health disorder. So those are all things that we need to take into consideration when we're talking about who can be at risk for suicide. Also, too, in case you didn't know, suicide is Arizona's 8th leading cause of death. So this is something that unfortunately in our country is rising. More and more people are killing themselves or dying by suicide. So this is something that's very important to talk about, and it's very important to talk about specifically with our older adults because they are at a higher risk population for completing suicide. And we'll talk more about those specific reasons.
Did you say the eighth?
Sorry?
Did you say the eighth?
I'm hearing an echo. I couldn't understand. I'm sorry.
The eighth most prominent form of death?
8th leading cause of death in Arizona is suicide.
I don't think that would be very. If there's 7 others ahead of it, that's or unless you're listing, I don't know what the other 7 would be ahead of it.
So heart disease would be number 1, cancer, kidney disease, those kind of things.
Okay.
Yes.
Disease.
Any other questions or comments? Okay. So when we talk statistically about the vulnerability of our older adults, so 1 out of every 4 older adults who attempt suicide dies, compared to every 1 out of every 1 to 200 young people who attempt suicide. So statistically, if we're looking at 1 out of 4, that would be a 25% statistic, whereas with 1 out of every 1 to 200, that's 0.01. So again, I'm not trying to say that not looking at teenagers is important, because it is, but we also want to be really mindful, and we want to watch out for our seniors, because seniors are at risk for completing suicide. Also, older adults are twice as likely to use firearms as a means for completing suicide as opposed to people who are under the age of 60. And also passive or indirect suicide is a possibility. Does anyone want to share what they think passive or indirect suicide is, or what that might look like? Has anyone heard that before?
I've heard the expression suicide by cop. Is that the same thing?
Okay, that could be a passive or indirect suicide. Any other
Rejecting?
ideas?
Yeah. Rejecting medicine or surgery.
Thank you. Rejecting medicine or surgery. So somebody that is taking medication or needs to have a surgery or procedure done, and they're choosing to not take medications or not do the surgery. Certainly there can be other things there that could play into why that is. But if somebody is no longer taking medication, if they're going off of diets or specific foods that they need to be eating, that would be a really good indication that something has changed. So that would be a good way to kind of start thinking about, why is this person doing this, and to start a conversation. So thank you to the woman who shared that. That is a passive or indirect possibility for suicide. Any other ideas or thoughts that you might have on what passive or indirect might look?
Overdose of medication.
Overdose of pain medication.
Okay, I heard overdose of pain medication, and then I heard someone else.
Overdose of medication.
Overdose of medication. Okay, so yeah, that could be an attempt to take their life. Absolutely. When we look at older adults too, we may or may not put 2 and 2 together that someone who is misusing their medication, whether it's intentionally or unintentionally, we may not necessarily put 2 and 2 together that this is someone who might have been considering suicide or somebody that is trying to kill themselves. I had a lady who shared with me very recently in a presentation that I did that her mother actually stopped eating, and she had no idea or any indication that that could have been because she was considering suicide. So that's another example of possibly indirect or passive suicide, is someone who is choosing not to eat. Now, again, could be other things going on there, but that is another example that we may not think, oh, this is someone who could be considering suicide. So just some different examples or things to kind of keep in mind, that if we're noticing those changes, we definitely want to be cued in and start asking, why is that changing? Any questions or thoughts about this specifically?
My mother did that, and she planned to not eat, and she was so clever about it, she decided to leave one residence and go to the nursing home so that she died in the comfort where she wanted. And from the time she got there, she stopped eating, and they told us about it. And we and her doctor talked to her, but she just said, no, I'm not doing that. But, and that was she knew exactly what she was doing.
Thank you for sharing that. And I'm sorry for your loss. And that is something that unfortunately can happen. And it's something that we need to keep our eyes out for and be able to notice those kinds of things.
As an attorney, I experienced with the loss of a child in a custody dispute, which caused suicide to one of the parents that lost custody of them. And also for older adults that were getting divorced much later in life, also raised a great deal of concern and treatment for people that experienced after 50 years of marriage. Now it's over and they don't know what to do with themselves.
Exactly. Yes. And we'll talk about some very kind of specific examples, but those are 2 examples that also can occur as well. So thank you for sharing. So let's talk about some of these factors or contributing factors. So isolation, someone had mentioned earlier about isolation. So older adults who attempt suicide and who are isolating, they're more likely to have a plan, and they're more likely to be determined to die. than younger people. These are people that if they are thinking of suicide, they have more time to think about it. They have more time to really think about the method and really be precise. And also, unfortunately, they're less likely to be found. So if they do attempt to take their life, they're less likely to be found before they pass. So isolation can be a contributing risk factor, not just to suicide, but also to some other mental illnesses. And so that's something we want to keep our eyes on. Also, poor health and chronic illness. So that can increase feelings of hopelessness and helplessness. A lot of times hopelessness and helplessness go together. And so if people are feeling that way, it can decrease their will to live, which can increase depression and anxiety, and that can also increase the risk of suicide. Also, access to lethal means. So as I shared earlier, 60% of completed suicides in Arizona are because of the use of a firearm. So if we know that somebody either has firearms or if they are trying to obtain a firearm, that's something that we want to keep close eye on as well. If somebody is talking about getting a firearm or wanting to have a firearm, that might be a clue or an indication that something has changed. And so if we know that somebody maybe is experiencing depression or is going through a difficult time, and we know that they have access to lethal means, that's something that we need to keep our eyes out for as well. For those of you that attended the RX Matters presentation that I did last month, also keeping on to medications, not disposing, but if you're stockpiling your medications, that can also be a risk factor. So if somebody has an overabundance of medication, they can use that to take their life. And we'll talk more specifically about means of lethal means, but just to give you an idea of the completion rate here in our state. So challenges that older adults face. Now, in no way is this list all inclusive. These are just some of the challenges that older adults can face. But certainly death of a loved one. Unfortunately, as we age, we tend to lose people at a quicker rate. And it's not uncommon for people to be the only one left in their family. They may not have siblings, or maybe their siblings have all passed and they're the only ones left. If somebody is a widow or a widower, if they are socially isolating, so that can be a little bit different than isolation within itself. So social isolation could be somebody that is choosing not to go out, but they're not also engaging with family, with friends. Maybe they're not going to, coffee group or book club or things that they would normally do. They're choosing to isolate socially as well. Now, loss of status, this is another interesting one. So loss of status could mean a few things. Loss of status could be maybe somebody who has had a job for 40, 50 years and they no longer are working. Maybe that's because they retired or other reasons. That could be loss of status. It could even be when your children move out of your home, and they call that the empty nesters. Sometimes that can be a loss of status because you've had your children in your home for so long, and if they're not there anymore, that can be a challenge. It can also be a celebration. I guess it depends on how you look at it, but for a lot of people, it can be a very hard time. Loss of sense of purpose. We all need to have a sense of purpose in life. We need to know who we are and why we're here. And so for some people, they may lose that sense of purpose if they don't, if they're going through a hard time, or maybe things have changed, and that can be a challenge. Loss of a pet. So a lot of times when we're talking about older adults, they may not have children, or they may not have other family, but to them, their pet is like a child. It's someone that they hold very dear. And so if someone loses a pet, that can be very, very challenging. Financial problems certainly can be a stress. If someone has physical disability, illness, or pain, chronic pain can be very debilitating. It can be very difficult to have a positive mindset. And so dealing with some of those challenges can be very, very difficult. If somebody has mental illness, whether it's diagnosed or undiagnosed, also substance abuse. So if somebody is using substances, or if they have been using substances for a long time, that can certainly be a challenge as well. So again, this is not an all-inclusive list, but just so you can see what are some challenges that older adults can face specifically when it comes to as we age, and also talking about depression, anxiety, or suicidal ideation. So before we go into talking about depression, are there any questions, thoughts, comments before we move on? And again, just unmute yourself if you have a question. Okay, I'm not hearing or seeing anybody, so I'll go ahead and move on. So I like to talk about what depression is, because I think we all have an understanding or an idea of what we think depression is, but I kind of want to go a little bit further to make sure we have a good baseline understanding of what that can look like. So when we're talking about mood and emotions, sadness is certainly a part of it, irritability, anger, feeling profoundly empty, again, that hopeless, helpless that I talked about earlier, and having little to no motivation or interest. That's a really, really big one, because when you go to your doctor or you go to a provider who's going to help you or help someone with depression, really important to highlight not just the physical things that are changing, but also highlight the behavioral things that are changing, highlight the psychological things, the things that you're thinking in your head. That's the information that they're going to need to really make sure that they understand, okay, this isn't just they're having trouble sleeping. This isn't just they're going through a hard time. This could be depression. So really important, if you're noticing that little to no motivation or interest, if you have hobbies that you love to do and you're finding that you no longer like to do those hobbies, that is a change. That is a big change. So that would be something that's very important to highlight. Some things, thoughts that we might think. So if we have a clouded mind, if we're confused, if we have difficulty remembering, if we're having negative thoughts about ourselves or other people, and if we're having thoughts of death and suicide, that could certainly be depression. In our body, so for those of us that have never physically felt depression, it is not just in our mind, it is a physical manifestation. It hurts. It feels like aches and pains. It feels like little to no motivation or energy. It feels slow. It feels sluggish. For some people, they might get headaches. They might feel nauseous. They may not feel well. So just to put some perspective on it too, it's how we feel physically, but then also emotionally and mentally as well. And then also behavior. So some of the behavior changes that we might see. Sleeping too much or too little. With depression, we tend to see more of the sleeping too much. Certainly it could look like sleeping too little, but with depression, it tends to be someone who's sleeping 20 hours a day, something like that. If you're eating too much or eating too little, if you're isolating, the thing with depression is that you want to isolate. You don't want to be around other people, because people who are depressed, they might feel like they're a burden to other people. And I hear that a lot with older adults. They don't want to feel like they're a burden. So they feel like if they isolate and they push themselves away, that they're not going to feel like a burden. So that isolating piece is really, really crucial. And then, like I said, if you're not interested in hobbies or things that you once were interested in, that is a big change. And that's something you would want to tell your provider or your doctor. With older adults too. So older adults tend to go to their primary care physician. So when they maybe are feeling some of these things, they tend to go to their primary care physician. Primary care physicians are getting better with asking more questions and doing screenings and those kinds of things. But if they're not doing those questions, or if they're not doing those screenings, I really encourage you or whoever that you're concerned about to really share with the doctor some of those deeper things that are happening. I do have a resource folder that I normally hand out in this presentation, but I want to share with you a couple resources that I have. One of the things that we give out in the presentation, and I'll do my best to show you in the little box that I have. So this is called the PHQ-9. This is one of the screenings that the doctors or mental health providers might be able to do with you while you're on a visit. If you're interested in obtaining a copy of this, this is a self-done questionnaire, but this is something that you can do. And based on your score, you can give this to your doctor or to your provider. And this can be a really great way to start the conversation that some things have changed and maybe you are concerned if you have depression, or if you're concerned about a loved one or a neighbor or a friend. Having this resource can be really helpful. So this is called the PHQ-9, and this is something that can be helpful. There's other screenings out there and other kinds of things that can be done, but having something like this already to give to your doctor can really be helpful. So that's something I would recommend obtaining. And again, I put my information in the chat box. If you want to email me or call me, I'd be happy to get that information out to you.
I would bet that you can Google it.
I'm sorry?
I would bet you can Google it.
Sure, you could Google it as well. Yep, you could Google it, or I'd be happy to send it to you, whatever works, whatever's easier. Okay, so I'm going to move into talking about anxiety. A lot of times depression and anxiety can go hand in hand, but they don't have to. You can certainly have one or the other. But when we talk about anxiety, this is fear or excessive worry. So it's normal to have anxiety about certain things. So for example, if you're driving in a car and there's a car that stops abruptly in front of you, you may have anxiety about stopping in time. That would be more of a kind of normal anxiety. Yeah. But when we're talking about excessive fear or worry, like there are some people that they won't ever get into a car because maybe they got into a really bad car accident, or maybe they just don't like cars, whatever the reason is. If it's excessively worrying about something, that might be where a concern would lie. If somebody is avoiding social situations, there are people who have very severe social anxiety. So being around other people, talking to people, being in crowds can be very difficult. Being overly concerned about safety. For a lot of us, we carry our stress and muscle tension like here in our neck or shoulders or back. So that can be really hard if we're really tight and tense. A lot of anxiety can be manifested here. It can also be headaches. I know when I have a lot going on, I tend to get headaches. And so it can look like headaches, it can look like spasms, all kinds of things. Difficulty with concentration. So someone who is experiencing anxiety or even having a panic attack, which I'll talk about in a moment, it's going to be really hard for them to focus on something, and it's going to be difficult to concentrate. So some of these symptoms or things that you might see below, so like racing heart, sweating, nausea, those can be symptoms of a panic attack. And panic attacks can come on suddenly. They usually peak around 10 minutes or so, but it can be very, very scary. If you've ever had one or if you've ever seen somebody have one, it can be very scary to experience. A lot of times, some of the symptoms can look like you're having a heart attack. And so that can be really scary. It can feel really scary. I know for me, I personally have had a panic attack. I literally thought I was going to die. My heart was racing. I had trouble breathing. I just wanted to curl up in the fetal position. But after about 10 or 15 minutes, it started to climb down and I started to feel better. But imagine somebody that feels like that on a daily basis. There are people who experience those kinds of feelings on a daily basis. And then also poor sleep. So certainly poor sleep can be attributed to anxiety or having panic attacks. And those are going to be things that you would absolutely want to share with your doctor or with your provider. Any questions about depression or anxiety? Okay. So some of you that might have attended the RX Matters presentation, you probably have seen this slide, but the reason why it's highlighted again is because it's important to know what a standard drink looks like. Alcohol can affect things like suicidal thoughts or ideation. Someone who may have depression and or anxiety, alcohol can affect this because alcohol is a depressant. So when we take a look at this screen here, it's going to show us what is considered a standard drink. So 12 fluid ounce can of regular beer with about 5% alcohol is equivalent to about 8 or 9 fluid ounces of malt liquor, which is about 7% alcohol, which is equivalent to 5 fluid ounces of table wine, which is about 12% alcohol, and then also a 1.5 fluid ounce shot of a 80 proof spirit, which is about 40% alcohol. So when we take a look at alcohol percentage, we take a look at the amount of alcohol, it differs on what is considered a standard drink. And this is important to highlight too, because we need to be truthful when we share with our doctors and with our providers when they ask, you know, how much alcohol or how many drinks do you have in a week? This would be a good indication of what they're really talking about. So that's why we talk about this, because alcohol, like I said, is a depressant and can affect some of these other things as well. Also, heavy drinking can worsen medical conditions that are common to older adults. If you're mixing medication with alcohol, that can really be problematic. And then also, just to let you know, when we talk about binge drinking, that is equal to more than 3 drinks for men and more than 2 drinks for women. So just to give you an idea, as we age, our metabolism slows down. We don't process alcohol like we did when we were younger. So alcohol can have an effect as well. Medication misuse. I talk about this in this presentation too, because if we're misusing medication, it can cause other issues. So it can increase risk for disorientation, confusion, and dizziness, which can lead to falls and injury. It can also change or create change in our mood, and that can cause problems with our relationships. If we're noticing that medication is causing disturbances in our mood, then we definitely might want to take a look at medication. Or is it being mixed with anything? Is the dosage correct? Those would be things that you could talk to your pharmacist or doctor about. And then also, it can be used as a negative coping strategy. So somebody that is going through a difficult time, they may be using medication and or alcohol to cope with what's going on. They may use that as a negative coping strategy for emotional pain. And so that's something that's important to take a look at as well. Any questions about this? Okay, keep on moving. So I'd like to have a discussion if we can. We'll see how it goes with all of us unmuting and talking at once, but what is the difference between sadness and depression? So does anyone want to share what they think the difference is between sadness and depression?
Please don't be shy. I see. Unmute your mic if you're going to speak.
Okay. Maybe sadness goes away, depression doesn't.
Perfect. So sadness can go away. Depression is unrelenting. It doesn't just go away. Thank you. Any other thoughts or ideas?
Murray?
Sadness could be connected to one particular type of incident, whereas depression is just general overwhelming.
Good. That's a really good answer as well. Thank you. What else? Just go ahead and unmute yourself.
Murray Sharkey has go for it, Murray.
Go ahead.
There was just a comment from Judy to everybody, which I would say the same thing. That one is debilitating and the other one is not.
Yes. And I
So
saw,
Judy Levy said that. So I'll give her the credit.
I'm starting to look at the chat box. I apologize for not looking at it before, but yes, Judy, thank you for sharing. Depression is debilitating, absolutely.
And I also think that sadness is just a specific environmental, not condition, but incident that happens. There's a real reason, and most people will feel the same way for a particular reason, whereas depression is really a physical, chemical imbalance.
Thank you. Really, really good answers. So yeah, all of you that spoke and shared in the chat box absolutely hit it nail on the head. So depression is debilitating. Sherry, thank you. Depression is like a deep, dark hole. Absolutely. It's debilitating. It takes over every part of your life. It's something that is unrelenting and doesn't just go away. For a lot of people, they need some sort of resource, support, professional that is trained to be able to work with folks that have depression. It's not just something that will just go away, whereas sadness will go away. Sadness could be something like your child forgot to call you and they said they were going to call you. Of course, that would make us sad, but depression is something that is ongoing. Something that I want to talk about with depression is that if you are feeling unrelenting, ongoing, nonstop symptoms for 2 weeks or more, that's the baseline that we suggest to let your doctor or let a professional know. Because if it's longer than 2 weeks, it will continue to manifest, it will continue to develop. And unfortunately, with depression, it's harder to treat the longer it goes untreated. So if you're having these symptoms or if you're noticing these symptoms with somebody else for 2 weeks or more, where it's unrelenting all day, it's affecting every facet of your life, you definitely would want to talk to a professional at that point. And so that's a good baseline or something to highlight if you didn't already know that. Any other comments or thoughts about this before I move on? Okay, so again, 2 weeks or more, if those symptoms are present, I would recommend that you talk to your doctor or a mental health provider. Okay, so now looking at risk factors specifically for suicide. So if somebody has multiple medical conditions, if they have mental health issues, the next one I want to highlight is prior suicide attempts. This is a big one because if we know somebody has attempted before, whether it was recently or whether it was a long time ago, we know that somebody has attempted, and people who attempt suicide are 2 to 3 times more likely to attempt again. So if we find that information out, that's definitely a risk factor we would want to pay close attention to. If pain and role function decline, if there's social dependency and isolation, if there's family discord or family difficulties or family arguments, if there's difficulty in the family, that can be a risk factor. If the person has access to lethal means, so we talked earlier about firearms, that can also be strangulation or hanging, that can be medication. There are different things that people use for completing suicide. Also, personality, inflexibility, or rigid coping. There are just some people that they're very rigid, they're very inflexible, they just are who they are, and it can be really difficult to either change their mind or persuade them. And so that can definitely be a risk factor as well. Also, with the pain and role function declining, That can also attribute to loss of purpose. And as I talked about earlier, loss of purpose can be a difficult risk factor or something that's challenging when we talk about older adults. Again, this is not an all-inclusive list of risk factors, but these are going to be prominent ones that we would want to pay close attention to. So what are some—
wondering what social dependency, I was wondering what social dependency is, yet social dependency or isolation, and they sort of seem like opposites or something. I don't know. So it seems like you want to dependence.
So social dependency, so we want people to be connected to other people, to their community. We want them to have a sense of purpose. But social dependency would be if they are so reliant on one individual. Like I've seen with older adults, they're so reliant on whether it's, you know, a child or a friend, just somebody that they're constantly needing something from, they're constantly just super dependent on. It could even be a spouse too, but having that dependency on somebody else, that can be where the risk factor might come into play. And then the isolation piece is that they're not letting other people, they're not letting other people help. They're just only relying on like one or two or just a close knit of people. They're not accepting either other help or other ideas or anything like that. So that can be hard because if we're not kind of open to other things, that can be hard. Trying to take a look at the chat box too as I go through this as well, because a lot of you are sharing in the chat box, so thank you. Any other questions? Okay. So going into protective factors. So these would be things that we would take a look at that might make somebody less likely to either consider suicide or complete suicide. So if somebody has religious and or cultural beliefs that discourage suicide, that could be a protective factor. I hear some of the older adults that I've talked to, they'll flat out say to me, I would never kill myself because in my religion, it's a sin, or whatever they're going to say. So that's enough to keep them protected so that they would never complete suicide. If they have strong connections to family and friends, if they have community support, so feeling like a member of your community, having support from your community is very crucial. If someone has conflict resolution and problem solving skills, if they have a strong supportive relationship with their doctor or mental health provider, and then also just being optimistic. People that are optimistic, that have a positive outlook, that maybe practice mindfulness or meditation or prayer, any of those things that can make ourselves be more optimistic, having a positive outlook, can actually be a protective factor. People that tend to be more pessimistic or have that viewpoint, they can tend to manifest those things into their mind, and then that can make certain situations more difficult to deal with. So these are just some protective factors that we share that can discourage someone from thinking of suicide. So what do we think about this slide? So it says the person who feels suicidal usually tells someone, but not always with words. What do we think about this? So the person who feels suicidal usually tells someone, but not always with words.
They're asking for help.
Okay, so what might that look like? So if somebody is not telling us verbally that they need help, what are some other ideas or ways or things that might change that might indicate that someone needs help?
Trying to get more attention, get their attention in different ways.
Okay, so trying to get your attention. Okay. What else?
Older people not planning ahead. They're like, they're not buying green bananas. You know what I mean? They're not looking forward to a future.
Sure. Yeah,
They're
absolutely.
in one place.
Absolutely.
So
Okay,
that
thank you.
they're not saying it with words, but they don't see a future for themselves.
Mm-hmm.
That's part of depression also.
But Ethel, you'd have to know someone really well to catch that cue.
That's true.
True. And that's a good point that you bring up, Rabbi. It's going to depend on your relationship with this person. There might be subtle differences or changes that maybe we may not pick up on depending on our relationship. But certainly if you know someone very well, you might be able to pick up on some of those other things.
And also, if you know them well, if they've gone to their attorney and have updated their will, or if they've just the opposite of you saying they're not buying green bananas, but maybe they are thinking of their heirs and how they're going to, loved ones left behind, making end of life plans.
Yes, and that's a good point that you bring up, because there is a difference between normal planning to death and dying and then suicidal ideation. So it can be normal to make changes in your will and to do those kind of things, but where it would be a concern is if maybe someone saying, I have to get this done by the end of the week. Like they have to make the change by the end of the week, they have to write their will. So if it seems like it's a very rushed decision or it's very quick, that might be where we might start to question, why does it need to be done by the end of the week? And that might be where we can start that conversation. So that's a really good point that you bring up. If we're noticing those changes, we might want to keep our eyes and ears open, but that might be a sign that something's going on. So thank you. All right, one more person to share, and then I'm going to move on because I just looked at the time. So anyone else want to share another kind of sign that something might be indicating towards suicidal ideation? Okay, so we'll go ahead and move on then, because I do have some more information that I want to share.
This must be a group of life. They don't know people like this.
And that's okay too. I mean, this can be helpful at any point in our lives. So like I said earlier, the person that is most likely to see a depressed suicidal senior is their primary care doctor. But some statistics that I have seen that are very concerning to me, of seniors who completed suicide, 80% saw their primary care physician within the month, 45% within the week, and 20% within 24 hours of their death. So clearly there's some sort of disconnect going on. Either they're not indicating what's really happening or the doctor isn't picking it up. There's some disconnect. So as I was saying earlier, it's really important that if you are going to your doctor or mental health provider, that you try to be as descriptive as possible about what changes are going on, what are the differences with behavior, those kinds of things. Because to me, these statistics are very scary and they're very heartbreaking. So some other warning signs that I want to go through. So if someone is cutting back on social interaction, self-care or grooming. So cutting back on hygiene or appropriate hygiene can definitely be a sign that there's something going on. If they're breaking off of regimens, going off of diets, prescriptions, if someone is feeling hopeless or worthless, it might be hard to decide, okay, how do we know if someone's feeling that way? It could be things that they're saying. It could be actions that they're taking. It could be things that they're no longer doing that they used to do. If someone's putting their affairs in order, giving things away, making changes to their will, again, this would be done in a very quick time. So if someone is trying to give things away quickly, or maybe they're giving things away that they normally wouldn't give away, like maybe they're giving away their cat and that's not something that they would normally do, that could be a great question. And why are you giving away your cat? Those kind of things. If someone's stockpiling medication or obtaining lethal means, if they have a preoccupation with death or a lack of concern for personal safety, Maybe this is somebody that is driving 80, 90 miles an hour on the freeway and they don't normally do things like that. If they're saying things like, this is the last time that you'll see me, or I won't be needing any more appointments, that doesn't necessarily on its own indicate that they're suicidal, but it definitely indicates that there's something going on that we want to look at. And then also the most significant indicator is someone who is expressing suicidal intent. It would be very helpful if people who were having thoughts of suicide said, I'm having thoughts of suicide. But in reality, we don't necessarily hear that. We don't necessarily hear people say, I'm thinking of suicide. And so that can be difficult to try to understand, well, how do I know and how can I help somebody? So what I tell people too is if you personally are having those thoughts, be clear and tell someone clearly, because then there's no ambiguity. There's nothing that can make that person think, oh, well, I thought maybe it was this instead of this. So be as clear as possible so that you can get to the help that you need. So another idea for life is treatment works. Why do you think that so many people don't ask for help? So if anyone wants to share, why do you think that people don't ask for help if they are experiencing some of these things?
They're embarrassed.
The stigma.
Stigma. Absolutely. In our society, there is a stigma about mental illness or mental health in general. They could be embarrassed either to admit that this is something they're going through, those kind of things. Absolutely. Any other ideas or thoughts?
Maybe they think they thought it out and they're very bright people and this is a decision they want to make.
Okay.
Who's to say,
okay.
A funny thing, who's to say they're wrong in their situation?
Sure. Thank you for sharing.
Ooh,
you know, it also, oh, go ahead.
I'm just curious, does God count?
Absolutely.
No, that person didn't check that one. You're right. I realize that.
No, but I know what you're saying. I totally get it. There's
They didn't consult God.
No.
They left that one out. If they had, they would have changed their mind. Or at least delayed it until they talked to you.
So there's a lot of reasons why someone may not ask for help, and we could honestly spend a lot more time talking about that. But just know that treatment does work, and that asking for help and getting help is something that we either want to do ourselves or encourage other people to do if they are struggling. With suicide too, this is a matter of life and death, so we really want to encourage people and try to get people help to the appropriate help. So asking for help is a sign of strength. So there tends to be a stigma in our society that if you ask for help or if you reach out for help, that it's a sign of weakness. And when we're talking about suicide or talking about getting help for mental health, asking for help is a sign of strength. For any of you that have experienced mental health issues, it is extremely difficult to ask for help. It can be very difficult. It can, raise a lot of kind of interpersonal issues and take a look at, our own morals and values. And so it can be really difficult to ask for help. And so I want to highlight that asking for help is a sign of strength. Like I said earlier, be clear. If you are having thoughts, tell somebody, I need help. I'm having serious thoughts of suicide, just so they know what we're looking at here. Also, avoid the temptation to isolate yourself. Be around people that, who love you, you love them, and really surround yourself with people to get you help. Sometimes too, I've heard from people, they say to me, I had no idea that I was depressed until somebody else told me. So sometimes what happens is it takes somebody else, a loved one, a neighbor, a friend, to tell you, hey, I'm noticing that these things are changing. Is everything okay? And that might be what sparks that individual to go to their doctor or to go to their mental health provider to get the help that they need. So what can you do? So I know I've given you a lot of information about signs and symptoms and risk factors and those kind of things, but what can you do to help if you are concerned about someone who either is depressed or may have suicidal ideation? Offering support. understanding, patience. I can't stress patience enough, and encouragement. Talking to them and listening. Listening is also really crucial, because if we're talking or if we're interjecting with what we think they should be doing or those kind of things, we're not really listening. So what I tell people is just listen. Listen to what they have to say. Listen to the reasons that they're considering suicide. What's going on in their life that's making them think like this? And don't be afraid to ask directly about suicide. I know that's really difficult, and asking somebody if they're thinking of suicide is a really difficult question, but you really could be helping somebody out if you're asking that question and if you are open to having that conversation. And I tell people too, if you know that you're just not somebody who can have that conversation, that's okay. That's actually a good thing to know about yourself, because then you know that you're not the right person, but you can connect them to somebody who is. Really important. If you are somebody that would like to help and would like to ask and have that conversation, these are some things that you can do to do that. We really want to try to abstain from judging the act or judging the feelings that led them to thinking about suicide. That's going to make someone less likely to open up, and we're not going to be able to build the rapport that we need if we're seeing or if we're saying things that might be considered judgmental. We don't want to offer advice. That's the other thing too. There's a difference between offering information and offering advice. So offering information would be giving somebody the phone number to a hotline that they could call. But we don't want to give them advice, because then if you give them advice and they take your advice and then it doesn't work out, they're going to come to you and say, hey, this didn't work out for me. And that's just not where we want to be. And then also don't go at it alone. Get somebody else involved. Ask the individual, what would be helpful? What person or what resource would be helpful? Maybe this is something that they've had thoughts before, or maybe they've gone through this before. What are some other people or resources that we can include in to help in this conversation? If someone is an immediate risk, so meaning they've said yes, that they're thinking of suicide, maybe they've said, I have a plan, this is what I'm doing. Maybe they're telling you the time, the date, very specific information. You really want to get them help now. You don't want to leave them alone. You don't want to just say, okay, here's the number to the hotline, good luck. Like, you really want to be either calling with them, getting somebody that can help them, calling their doctor. Some sort of intervention is going to need to happen here. And so the National Suicide Prevention Lifeline, and we have these little cards here. Get it close. So the National Suicide Prevention Lifeline, so this card here, it goes through those signs and symptoms again, but their phone number is listed here, the 1-800-273-8255. That's the National Suicide Prevention Lifeline that you can call. I will also share with you in a couple slides local resources. There is a Maricopa County crisis line that you can call. Sometimes it's even calling the therapist, it's calling the doctor, it's calling somebody that they trust that is going to help them. I would recommend, unless the person is either behaving aggressively or you are concerned maybe they have a weapon in front of you, I would maybe not call 911 first. You can call 911, but I would try to think of some other options first before calling 911. Try to, defuse the situation the best that you can. But again, if the person is behaving aggressively, maybe they're under the influence of something, then obviously you need to do what you need to do to keep safe. But think of some other resources or things that we could try first, as opposed to just calling 911 immediately. Any questions about that before I move on? And again, I will be sharing resources at the end as well.
I have a curious question, because you're sharing resources, and I know that some of the people that join us are not necessarily in the United States.
Okay.
Do you know if, let's say, Canada uses the same number?
So I know that the number here, the National Suicide Prevention Lifeline, it is specific to the United States. I don't know offhand what the Canadian number is, but some of those, like the assist training and Safe Talk, those were actually developed in Canada. So if you're looking for further training on this information, Living Works Education would be a really good resource that you can access here in the United States and then also in Canada as well.
And I'm going to search that, just curious.
Thank you. I appreciate that. All right. So I'm just going to go through some of these things really quickly. I know Judy and some other people in the chat have really emphasized exercise and absolutely exercise. Exercise is actually the #1 self-help strategy for people that are experiencing depression and anxiety. So if we can get people who have depression or anxiety to exercise, that is going to help them immensely. So thank you for bringing that up. But some things that we can do for good self-care, nurturing and building relationships, staying mentally and physically active, practicing relaxation, eating well, addressing signs and symptoms early on. So the earlier that we can get someone to help, the better, and the more likely they are to have a better outcome with recovery. Keeping track of medication, getting enough sleep, limiting or avoiding the use of alcohol, setting time aside for yourself. So practicing that self-care, but also being able to take a break, even if it's 15 minutes, to just do something that you enjoy doing can be very helpful. And then also don't be afraid to ask for help. So I can't stress that enough. If you or someone that you are concerned about need help, you know, telling the more people you can. Don't just tell one person, tell many people until that person can get help. So I showed this earlier in the presentation, but I'm just curious if thoughts have shifted or remained the same. But suicide can be prevented even if a person feels determined to take his or her own life. So does anyone have any thoughts about this or any changes in this kind of idea for life? I'm looking at the chat too.
Okay.
Okay.
And Lauren, I just I'm curious. I mean, I know when I took my course, which now you're telling me I'm Canadian trained. I think Morty's going to be happy. One of the questions that they had asked us, and I think sort of can be behind that same slide that you just shared, was what is your take on life in general? Because that will determine your view on suicide, and that will also determine your sort of the natural reaction to help somebody in that situation. Meaning if you don't think it's a problem, then you're not necessarily going to sort of go out of your way to help someone who's about to commit suicide. Sort of preconceived your own biases will determine how you're going to react.
Absolutely. And that's why I was telling people that the best thing that you can do is to decide kind of where you're at. If you're willing to help somebody, if you're not, then passing them along to somebody who can help is the best thing that you can do. Because we don't want to leave people who are actively suicidal alone. We need to get them to help. So if that's not you, that's totally within your right. If this is something that you want to help with, like I've been saying, there are other trainings and resources that you can take a look at. I had a couple questions in the chat about the resources. So up here, I have the resources that will be helpful. The Maricopa County Crisis Hotline, that's the one that's here in Maricopa County. That number is 602-222-9444. That's another number you'd want to keep on hand. The National Suicide Prevention Lifeline, which I've shared, but here it's up on the slide. Also, there is a veteran line. So if you are talking to someone who's a veteran, you can press 1 and that will link you to the veteran line. Also, if you have somebody that would prefer to text, you can text the word home to 741-741 and you can initiate a text conversation with somebody who is trained to help someone who is thinking of suicide. And then again, you can always call 911. I was just saying earlier, you know, maybe try to think of some other resources first before calling 911, just in case, because sometimes police may or may not have the training to help with suicide. I know some police departments do have that training, but there are other resources and things we might want to utilize first. If, you know, because I know a lot of people call 911 immediately, but there are some other things we can do first. Something I just want to share with the Maricopa County Crisis Hotline and the National Suicide Prevention Lifeline is they can actually send a mobile team to your location. So if you are needing somebody to come out, that's something they can do as well. And then these are some other national resources, web-based, that we can utilize. So that's all I have today. Like I said, I will be available for questions. You can call me or email me. Otherwise, thank you so much for your time. I hope this was helpful. And thank you, Rabbi, for allowing me to present this information.
No, thank you. I know how important of a subject this is, whether you know someone, or not you, I'm saying, but anyone on here who knows someone who has actually committed suicide or has thought of it. For me, actually, when I took the assist training, the most powerful thing about the entire 2 days was that the trainer was somebody who had attempted suicide, and so was talking from a real firsthand perspective. There was a lot of role playing, and I know how, I think this is, even this 1 hour of information is huge. It's
Thank
just,
you. I know I went a little over on time, but thank you again for participating. And again, I'll put my information in the chat in case you didn't catch that, for anyone that would like to check check in later.
Can I say something?
Yes.
Lauren, I really, really appreciated what you actually told us. I'm very happy that I logged in. You know, I've learned a lot. I've learned a lot, you know, and I've learned that Baruch Hashem, you know, I'm in my 87th year and I've got another 35 years to go, you know, so I'm good with that. So, but if I could digress, I believe the same amount of people are here when you were here as a pharmacist. I told you I have this pill. This is what this pill looks like.
Very good.
Remember
Thank you
when
so
you were
much.
a pharmacist? Yes.
Thank you.
And also the names are on the back and the actual times. I just thought I would throw it in. Thank you so much. And
Thank
be
you.
blessed. Right.
What is the phone number for Area Agency on Aging?
Great question. So we have our senior helpline, which is a 24-hour, 7-day-a-week hotline. And let me go ahead and put that in the chat, but I'll also share it with you out loud. So it's 602-264-4357.
4357?
602-264-4357.
Okay. And is there anyone from the area of agency on aging who would present this program maybe to an ORTH group or for DASA group? And is there a charge?
Are you talking about the mental health first aid and safe talk?
No, what you just did.
Oh, this. So this is free. I do this free of charge. All of the trainings and presentations that I do free of charge. We're a grant funded program, so we do not charge for any of these presentations. Mental health first aid and safe talk, those are two other trainings that I do. We don't charge for those either. We actually provide the booklets that go with the training free of charge as well. So please, if you are interested, or if you know a group that would be interested, please contact me. I'd love to set something up.
Okay, would we contact the 602-264?
I could give you her email address.
Yeah, and I put my email in here too, the lauren.friedman@aaaphx.org. I put it in the chat. But yeah, Rabbi, if you could follow up with anyone that would like follow up, I'd be happy to touch base.
Okay, and also I actually don't see it in the chat, so you might want to do it again for people who are on.
Whoops, I think I shared it privately. Okay, hang on. Sorry, everybody. Any other questions or anything I could answer?
No, I would like to just speak up for Area Agency on Aging. It's a marvelous organization. When I was married to my deceased husband, he abused me financially and verbally. And I went to, trying to think of her name. And I went to Area Agency on Aging, and who's in charge of that little group, the domestic violence group?
Oh, that's our Doves program.
The what?
Alice. Alice is,
Right.
she oversees the Doves program.
Is she still there?
Yes.
It's marvelous.
Thank you. I really appreciate that.
Yeah. And I was being not physically abused, but Area Agency on Aging and Alice Garib understands the other kind of abuse that there could be, such as verbal abuse and emotional abuse.
Thank you, Myra. I really appreciate that. The Area Agency, we have over 50 programs. The Senior Helpline, which is that 602 number, 264-4357. That's a great resource to call if you want to know more about the Area Agency. We also have a website too. Let me go ahead and put that in the box. But our website is also going to give more resources, more detail about everything that we provide, because we really do a lot of different things at the Area Agency. So thank you again, Myra, for sharing. Sherry, did you have a question?
You're muted, Sherry.
Oh, I think you're muted.
Can you address what's the difference between how a nurse practitioner would address depression versus a psychiatrist? Are they overlapping? Is there any,
Yeah, so a nurse practitioner, obviously would be under a medical doctor. Did you say a psychologist or a psychiatrist?
Psychiatrist or
Okay. So so a psychiatrist and a psychologist are different. So psychiatrists can prescribe medications, psychologists cannot. But I actually have two in the resource packet that I give to people when I do this presentation in person. We have a handout that says finding a therapist, but there's really good resources of how to be able to kind of navigate that, because that can be overwhelming for people to be able to find out which provider should they choose, what's the differences, those kinds of things. Something I recommend too, if you are interested in learning more about the resources that are out there, is contact the phone number on the back of your insurance card and talk to them about what is covered, what do I have access to on my health plan. That's really going to help too, to give you more of an idea. Thank you, Rabbi. So Rabbi went ahead and put in the number for Canada. So for those of you that might be joining in from Canada, they have a different phone number for suicide prevention. So thank you.
I actually texted with that text home or whatever you shared, and they're making sure I'm good.
Good.
But they shared the number with me.
Thank you.
After I wrote thank you, they wrote absolutely. Just to make sure, I want to keep you safe. Have you had any thoughts of suicide? So they want to make sure I'm not just asking for a friend, as they say.
Good. Good. Thank you. All right. Well, thank you so much for joining us today. Again, please follow up with me if you need to follow up. Otherwise, thank you for your time.
And thank you, Lauren. This was, I think, great information to have, empowering. And just to quickly share before everyone, if you are jumping off, if you're staying on to Schmooze, Wednesday we have a person, a Cuban immigrant, who's going to talk about Judaism in Cuba. He's also the director of the arts in Santa Fe for folk art and things like that. His name is Stuart Ashman. And on Friday, we have What You Do Matters, which is a program that was created to educate law enforcement about the ills of what the Holocaust can teach to law enforcement officers. It's a course that's taught here in Arizona that was created by the Jewish Community Foundation together with the Holocaust Museum in Washington, D.C. So we hope you'll join for those. But again, thank you very much, Lauren. I'm going to stay on here and chat. And again, if anyone does encounter someone, a friend, family, or stranger contemplating suicide, again, there are so many resources that you can share. But like Lauren said,
I was just wondering if there's, okay, I was wondering